طلبة المرحلة الثالثة السلام عليكم ورحمة الله. نكمل محاضرات مادة الفارماكولوجي 1، ومن خلال هذه المحاضرة إن شاء الله سنمضي خلال Drug-Receptor Interaction and Pharmacodynamics. The question here, how drugs act? Drugs normally act by different mechanisms. These include physical mechanism, like the osmotic diuretic effect that can be produced by the diuretic mannitol. And by the way, when we say diuresis, it means that the drug will enhance the loss of fluid or increases excretion of fluid from the kidney. Osmotic diuretics like mannitol. Mannitol has a large molecules that can escape through glomerular filtration and accumulated in the renal tubules. The osmotic pressure that's produced by the presence of mannitol molecules within the renal tubules will enhance the excretion of a fluid through the renal tubules, and this will cause diuresis or enhance diuretic effect. This is by a physical mechanism. Also, drug can produce its effect by chemical interaction. An example for a drug that can produce its pharmacological effect by chemical action include antacids. Antacids interact, which is normally used for the treatment of hyperacidemia or the peptic ulcer, which is an increased acidic production, hydrochloric acidic production in the stomach, and the subsequent effect of this increasing acid in the stomach can be harmful to the patient. So antacid will neutralize the increased acid production in the stomach by chemical interaction. Also, we have other mechanism, which is the stimulation or inhibition of enzymes that can affect the metabolism of other drugs or produce pharmacological effects by itself. And the most common is the drug-receptor interaction, and we go in next slides to explain in details how drugs can affect or produce pharmacological effects by drug-receptor interaction. Receptors by themselves are specialized target macromolecules, which are proteins in general, that present on the cell surface. It also can be present within the cell, inside the cell. Signal transduction, as a term, is the process by which drug-receptor complex initiates alterations in biochemical and or molecular activity. This is the shape or an example of receptor that could be presented on the cell membrane when it is occupied by the drug. And by the way, when the drug has the ability to occupy a receptor, it is called substrate. And this substrate could be an agonist that initiates a pharmacological effect, or could be an antagonist that prevents the receptor from initiating pharmacological effect, and it could be partial agonist, which can induce a pharmacological effect but not at the same extent that can be produced by a full agonist. Anyway, we'll come to this later inshallah. If the drug is occupied by an agonist drug, this can produce a conformational change or activating the receptor that will cause subsequent biological processes. This is called signal transduction. Receptors are normally present in two states, either in the inactivated state or the activated state. The ability of the receptor to convert between inactivated and activated depends on the occupation of the receptor by a ligand or agonist to convert it from inactivated to an activated state. So when a drug, which is agonist, is bound to the pockets or the space available in the receptor for the binding. In this process we call ligand binding domain or space, and this will cause a conformational change in the receptor that will cause to the formation of drug receptor complex and conversion of the receptor in the active state that will produce biological effect. The rate at which drug is bound to the receptor and converted to activated state is determined by a rate constant. Also, there is a rate constant for the release of a drug from the drug receptor complex and inactivation of a drug to go back to its resting state or inactive state. Families of receptors are there are four families of receptors. These are ligand-gated ion channels, in which when the drug or the substrate is bound to a receptor, this will cause an opening in an ion channel, and then this will permit the movement of ions either inside from outside the cell to intracellular domain or the other way around. And an example of this is the binding of acetylcholine, which is a neurotransmitter available in the system. This will cause an opening on the sodium channel. This will permit influx of sodium inside the cell and outflux, which is movement from inside to outside, of potassium ion. This will cause a disruption in the action potential of the cell and subsequently will cause an subsequently will cause a biological effect inside the system. For acetylcholine, for example, it causes when it links to nicotinic receptor in the neuromuscular junction. This will cause an enhancement of the muscular contraction in the skeletal muscle. Other example of or family of receptors is the G protein coupled receptors. These are available on the cell membrane as well. You can see here the G protein coupled receptors are composed of 7 trans membrane domains or helicals, and usually these are they have an outer domain which can bind to a substrate, whether agonist, antagonist, or partial agonist, and then they have intracellular domain where it's linked to a second messenger. Second messenger in this case is G protein. G protein is usually composed of 3 main domains, which are alpha, beta, and gamma. The binding of a receptor to, the binding of an agonist to the receptor will cause conformational change in the G protein, and this will enhance subsequent mechanisms that will lead to produce biological effects. Another type of receptors is the enzyme-linked receptors. An example of these receptors is the insulin receptor, where the insulin is bound to the extracellular domain of the receptor. This produces the activation of phosphorylation enzymes, and this will cause subsequent intracellular effects. Also, we do have the intracellular receptors, which are not present on the cell membrane. In this case, the receptors are presented or available inside the cell itself. And an example of these receptors are steroid receptors, where these are available inside the cell. When steroids can reach these receptors, they can modulate the gene expression and therefore the protein synthesis and produce pharmacological or biological effects. The first example, as we said before, is the transmembrane ligand-gated ion channels, which are presented on the cell membrane binding of a ligand, like a neurotransmitter, like an acetylcholine will cause a change in the permeability of ions through these channels, and therefore change in the action potential in the cell, and produce pharmacological effect. Usually, the effect that is produced by a ligand to these receptors can last from less than few seconds, or can last for few seconds only. An example for a ligand that can be activate this receptor is acetylcholine when it is linked to nicotinic receptor. This will cause a sodium influx, which is the entrance of sodium ion from out of the cell to inside of the cell, and potassium ion will exit out of the cell, and this will stimulate the contractility, or enhance the contractility of muscular muscles and produce contraction. Another example is the binding of gamma aminobutyric acid, or GABA receptor occupied by an agonist. This will cause hyperpolarization of the neuron due to the entrance of chloride ion, and prevents the cell from propagation of action potential, and therefore it acts as an inhibitory mechanism to the initiation of action potential in neuron cells. Also, inhibiting sodium influx by the action of sodium channel blockers, which are normally act as a local anesthetic, for example. In local anesthetics, they bound to sodium channels and prevent the influx of sodium ion, and then prevent the propagation or the initiation of action potential, and therefore can produce anesthesia by preventing the movement of pain, or the sensation of pain to the central nervous system. The other type, as we said before, is the G protein coupled receptors. As we said before, these are transmembrane receptors that have outer domain in which there is a ligand binding domain or area at which the receptor, the drug, can be bound, whether it's agonist, antagonist, or partial agonist. If it is the substrate, if the substrate is an agonist, then this will initiate the intracellular mechanism through the G protein receptors. G proteins, by the way, could be one of these types: GS proteins, GI protein, and GQ protein. Each one of them has a different subsequent intracellular mechanism if they are activated by an agonist. The binding of ligand to a G protein coupled receptors can last for a few seconds to few minutes, and you can see here in this figure transmembrane G protein helicals. They can pass through the cell membrane, if you consider that the cell membrane this level, and these can move through the cell membrane through these 7 helicals structures. Okay, so for G protein coupled receptors, as we said, we have 3 main types of G proteins that is attached to G protein coupled receptors. These include GQ, which is linked to alpha-1 receptors, and then when an agonist like adrenaline or noradrenaline is linked to activate the alpha-1 receptor, this subsequently will activate the GQ intracellular domain, and therefore this will cause phosphorylation, cause the activation of phospholipase C, and this will cause the conversion of phosphatidyl inositol diphosphate to inositol triphosphate, and diacylglycerol inositol triphosphate will increase the intracellular concentration or release of calcium from the intracellular reticular smooth muscle, and therefore cause a smooth muscle contraction. If the alpha-2 receptors are occupied by antagonists, this will activate the G protein coupled to these receptors, and this will inhibit adenylate cyclase from converting ATP to cyclic AMP, and subsequently this will cause smooth muscle relaxation as the cyclic B concentration will be decreased, and also there is a direct mechanism by which calcium can be inhibited. This mechanism therefore will cause an inhibition of transmitter release, and therefore producing relaxation of smooth muscle. When an agonist occupied to beta receptors, whether beta 1 or beta 2, this will cause the activation of GS protein, G protein. This will cause activation of adenylate cyclase. Activation of adenylate cyclase will cause if the receptor is within cardiac muscle, this will increase cardiac muscle contraction, and if it is within smooth muscle, this will cause a smooth muscle relaxation, and if it is within the cells responsible in which glycogenolysis happen, this will cause increasing glycogenolysis and therefore increasing glucose synthesis by the action of normally beta 2 receptors. For enzyme linked receptors, if the agonist is linked to the enzyme linked receptor, this will cause a conformational change at which there is an intracellular enzyme activation. An example for this type of receptors is insulin, which insulin receptor, which is occupied by insulin, and this will cause insulin binding, will activate receptor tyrosine kinase activity, which is the enzyme that we said it's linked to the receptor in the intracellular domain of the beta subunit of the insulin receptor, and subsequently tyrosine kinase will cause phosphorylation of other proteins, for example, the insulin receptor substrate, insulin receptor substrate, and subsequently this will activate multiple signal pathways that will result in biological effects of insulin, which is the enhancing the uptake, for example, of glucose by different cells. For intracellular receptors, usually the steroid should be able to pass through the cell membrane and entering inside the cells. For steroids, therefore, they should have enough lipophilic ability or lipophilic characteristic that enable them to enter inside the cell and produce pharmacological effect, to be able to bind to the hormone receptors within the cell. Complexation of steroids with the hormone to the intracellular hormone receptor, either in the cytoplasm, as in this case, or maybe directly in the nucleus of the cell, will forming the hormone receptor complex that would affect this complex, would interact with the DNA in the nucleus and altering the gene expression and protein synthesis within the cell. Usually this effect produces an effect for longer time than that is compared with the enzyme linked receptors or G protein coupled receptors or ligand gated ion receptors. In this case, in the intracellular receptors, the effect might be continue for days as compared with others. Signaling transduction is a phenomena that is happen with the activation of a receptor and the subsequent processes that occur due to this activation of the receptor. Signal amplification is happen with G protein coupled receptors and enzyme linked receptor. In these processes, and let's assume this ball is an agonist that hits the receptor from this first place, and this will activate subsequent cascade of events that produce multiple pharmacological and biological effects. This is called signal amplification. It means that one hit produces more than one action, produces more than one action. This is signal amplification. As we said before, this happens with G protein coupled receptors and enzyme linked receptors. Spare receptors is also another term that is usually used in pharmacodynamic. This means that there is no need for the occupation of all receptors, all available receptors on the cell membrane by a substrate to produce the full response. Let's go back maybe and see if the receptors are not totally occupied. There is no occupation here, the response is very low, but then when some of the receptors is occupied, the full response is produced. In this case, these free receptors are called spare receptors. In another case, the number of spare receptors is different. Maybe in other case, we do need to occupy most of the receptors to produce the full response of the drug. And here in this case, the spare receptors are only small fraction of the available receptors. An example of the first case where spare receptors are very large is the insulin receptors. In the other case, the beta receptors, for example, only 5 to 10% of the receptors are available as a spare receptors. Okay, another term that is commonly applied or phenomena that occurs in pharmacodynamics is downregulation and upregulation of receptors. The expression in these processes, the expression of receptors on the cell membrane can be changed. In case of upregulation, if the available substrates for the receptors are very low in concentration, then the cell will assume that there is a need to express more receptors on the cell membrane to produce a pharmacological effect. In this case, the number of receptors that is available on the cell membrane will be increased. This is called upregulation. On the other hand, if the number of ligands or agonists is widely available in high concentration and most of the receptors are occupied by the agonist, then the cell will try to decrease this pharmacological effect by decreasing the number of receptors available on the cell membrane, and therefore this process will be called down regulation. So upregulation and downregulation of processes are linked with the availability of the substrate and the stress on the cell that will cause downregulation or the absence of a substrate and the subsequent increase in the expression of receptors and causing upregulation of receptors. Desensitization or tachyphylaxis is another term in pharmacology in which the effect of a drug gradually diminishes or decreases when it is given continuously or repeatedly. It develops in the course of a few minutes. So the desensitization or tachyphylaxis occurs usually within a few minutes. Tolerance, on the other hand, is a gradual decrease in responsiveness to a drug, which normally takes days to occur or even weeks to occur. The tolerance occurs when increasing amount of opioids, for example, like morphine, are required to achieve the same effect. The first case, tachyphylaxis, can occur with the administration of beta-2 receptor agonists like salbutamol. In some cases, the tachyphylaxis effect appears or develops within a few minutes, where the higher concentration of the substrates are required to produce the same pharmacological effect that was produced previously with a smaller concentration. Tolerance, for example, in the other hand, tolerance will take longer period to decrease the pharmacological effect or the response to a drug. And in the case of opioid, like morphine, we do need to increase the dose for the patient to get the same response that we usually get and if we administer smaller doses in previous days or weeks. Therefore, tachyphylaxis is acute tolerance since it develops at shorter time, is a similar mechanism that develops more rapidly. This clinically can occur in local anesthetics, for example, upon repeated administration. Noradrenaline when attempting to maintain raised blood pressure in some patients with shock. Uh, uh, it can develop also tachyphylaxis. So in these cases, if we want to attempt or maintain raise blood pressure or increase blood pressure, an alternative to noradrenaline can be administered like angiotensin 2 is suitable since beta 2 receptors or beta receptors can develop tachyphylaxis in these cases. Okay, so drug receptor interaction. For drug receptor interaction, the drug should have a characteristic that enables it to be fitted to the receptor. I guess you do know the lock and key phenomena for the drug receptor interaction. Each agonist or substrate should have a conformational change, or conformational characteristic or features that enable it from to be bound to the receptor to produce the drug receptor interaction. If this drug is an agonist, this will produce an effect by causing an activation of the receptor. If the substrate is an antagonist, also it has the ability to link to receptor, but then it will not activate the receptor. On the other hand, it will keep the receptor on the inactive state and prevent the agonist from binding to this receptor and produce pharmacological effect. On the result, binding of antagonist to the receptor will prevent the activation of receptor and will prevent the propagation of pharmacological response. Agonist versus antagonist. For agonist, a drug is called an agonist when binding to the receptor results in a response. For antagonist, a drug is called an antagonist when binding to the receptor is not associated with a response. Affinity. We will talk about the affinity of the drug to a receptor. The affinity is represented by this figure when a drug like an agonist have the ability to bind to a receptor and produce drug receptor interaction. The ability of this agonist to bind to the receptor is the affinity of this drug to the receptor, and the affinity usually expressed by the rate constant if the rate constant of the binding of agonist or the substrate to the receptor is more than the rate constant of dissociation of agonist from the receptor, then the drug has high affinity to this receptor. The same apply to if the case of antagonist. If the drug or antagonist has high affinity to the receptor, then the rate of constant for the binding of antagonist to the receptor is more than the rate constant for the dissociation from the of antagonist from the receptor. And the response is depend whether this substrate is antagonist, and this will produce no effect or no efficacy, and if it is an agonist, the binding will produce response or efficacy. So this is affinity is determined by how likely the substrate is bound to the receptor, and efficacy, it depends of whether the drug or the substrate will convert the receptor to the activated state and produce response. So affinity is how well a drug and the receptor recognize each other or like each other. Okay, so now we come to another term which is dose-response relationship. The magnitude of the drug effect depends on the drug concentration at the receptor site. If the available drug concentration at the receptor site is high, definitely this will occupy more receptors, produce more response, and then the magnitude or the effect itself will be larger. An example here, when we increase the occupied receptor by the uh, by the by the agonist, and this will cause an effect. Increasing the concentration will increase occupy more receptors, and increasing the response or effect, and so on until the receptors, enough number of receptors are occupied to produce the maximum response. And here in this case, 100% of the response was produced by occupying most of the receptors. And these receptors are not necessarily to be occupied. Let's consider them as spare receptors, which means that there is no need to occupy all the receptors to produce the full response, as we have explained in previous slides. Okay, so in the graded dose-response relationship, in dose-response relationship, the curve can be represented on the x-axis. There is a drug concentration. On the y-axis, there is the response. As we said in the previous slide, increasing the drug concentration will increase the availability of the drug on the receptors and enhances the drug receptor interaction that will cause an increase in the response or the effect produced by these receptors, and so on. So increasing the concentration will increase with time. Increasing the concentration will increase the response, and we can reach the maximum response by increasing the drug concentration up to this limit. So for drug A, if we take the log drug concentration, the shape will be in this shape. So it's called the S shape for the drug concentration. In the previous slide, we show the effect as like this shape here. Increasing this way, increasing the concentration will increase the response. Here we represent the concentration by logarithmic scale. And for normal drugs, this will give the characteristic S shape for the drug response curve if we consider the logarithmic scale for the concentration. So this is for drug A, where the concentration of a drug that is required to produce 50% response is called the effective concentration 50, or EC50, which is a characteristic for each drug to explain how effective or how potent this drug is. Drugs with low EC50 are more potent than drugs with high EC50. In another word, we need for drugs with low EC50, we need a small concentration of the drug to produce a response, while in cases like in drug B, for example, where the EC50 is larger than for drug A, this means that we do need higher concentration of drug B to produce sorry, the same effect that was produced by a smaller concentration of drug B. In this case, we call that A is more potent than B. Again, the EC50 is the concentration of a drug that is able to produce 50% of the response, and if EC50 is low, this means that the drug is more potent than a drug at which the EC50 is large. So a smaller concentration of drug A can produce larger effects than the same concentration as drug B. And EC50 of drug B is larger than EC50 of drug A. In this case, we call A is more potent than B. But both of them can produce the same maximum effects. This is called the Emax, or the maximum efficacy. Even though that we do need more concentration of B to produce the maximum effect, still both A and B can produce the maximum effect despite the differences in concentrations required to produce that effect. The concentration to produce maximum effect for drug B is larger than the concentrations required to produce maximum effect for drug A. But in both cases, both the drugs can achieve the maximum efficacy. In this case, we can say that drug A and drug B have the same efficacy, can produce the same maximum efficacy. So let's explain these terms. So potency is the quantity of a drug required to achieve the desired effect. And in the previous example, drug A was more potent than drug B because the quantity required for drug A to achieve an effect was lower than the quantity required from drug B to produce a desired effect. Efficacy is the maximum effect an agonist can achieve at the highest practical concentration, and this depends on the number of drug receptor complexes and the intrinsic activity of the agonist. Intrinsic activity is the ability of the drug to produce full response from binding of a drug to a receptor. We will come to explain this later, inshallah.